Experts warn those who work and live inside U.S. jails and prisons are especially vulnerable to the coronavirus outbreak. As of April 15th, 450 federal inmates and 280 corrections staff members have tested positive for COVID-19. 49 inmates and 18 employees have recovered. At least 16 federal inmates have died. For more, let's bring in Louis Reed. He's an organizer with Cut 50, an initiative to reduce the prison population. Louis, thank you so much for being with us.
Thank you so much for having me on.
So I know you've talked about this. You know firsthand what it is like to be incarcerated. You served nearly 14 years in a federal prison after being arrested for fraud, embezzlement, and a related shooting incident. Now you have degrees in criminal justice and psychology, and you are the national director for Cut 50. Tell us about the initiative. What is the ultimate goal?
Sure. So Cut 50 is a bipartisan criminal justice initiative of the Dream Corps, co-founded by Van Jones and Jessica Jackson. And essentially what we do is we go into spaces, we lift up the voices of individuals who are impacted by the criminal justice system, and we work with unlikely allies in order to change laws that disenfranchise people in their respective states.
So, Louis, how is this pandemic impacting some of the work that you do?
I can tell you that, in my personal opinion, this is the 4.0 medical equivalent of Hurricane Katrina. We are hearing from people literally all across the nation. I personally am in contact with more than 300 people who are incarcerated. They report to me day in and night out, Louis, this is like me standing in the middle of I-95 in New York, right in the middle of the road, and cars zipping by me at 117 miles an hour in both directions. And it's just a matter of time before I'm hit with this thing.
So, Louis, let's talk specifics here. What are your immediate concerns for people who are right now behind bars?
Sure. I think that first and foremost, how we respond to this crisis is going to define our identity for generations to come. Ensuring that we respect the dignity of people who have been detained in our bloated detention systems is critical to our legacy. We have to be able to reflect our collective response to this crisis and be able to say that we did the right thing, leaving no one behind. And what we are doing at Cut 50, we are making sure that no one is left behind. We are making sure that, to quote, paraphrase Jesus, the least of these are in the forefront of our mind and the forefront of our collective psyches. These are people who are going to be returning back to our communities. These are our mothers, our brothers, our cousins, our aunties, our uncles. These are people who make up the fabric of America. And so we have identified a plan that we think that is robust. We are working with governors. We are working with municipalities literally across the nation so that they can try to protect those individuals who are most vulnerable. In addition to the dedicated men and women who are in uniform in our correctional institutions.
I want to ask you, Louis, about the situation at the Cook County Jail in Chicago. We know there is a major outbreak there. Inmates have been staging hunger strikes to protest the conditions. And last week, a federal judge denied releasing medically vulnerable inmates and instead ordered more COVID-19 testing. What is your take on that?
Yeah, I think that judges denying requests really put people at risk. At Cook County, there are over 400 cases of coronavirus linked to the jail. Think about that. These are 400 cases of coronavirus cases linked to the jail. Letting people out is going to protect those individuals who are incarcerated while allowing the guards to maintain their safety. Let me also say this as well. When we think about our criminal justice system and when we think about our national imprisoned population, there are more than 2.2 million people who are currently incarcerated. Truth be told, the United States has the largest population of healthcare recipients that are not necessarily in our communities, but the largest healthcare system in the United States centrally is within our correctional institutions nationwide, and we have to do something, and we have to have a humanitarian response to it.
More broadly, Lewis, what are you hearing? Are prisons and jails across the U.S. taking appropriate measures to try to stop the spread of this virus?
What I think that we are in a very unprecedented time. I think that Department of Corrections across the nation are doing what they can do as best as they can. But the fact of the matter is this: there is always more that can be done. And so, what we're asking at Cut 50, number one, we need to identify those people who are scheduled to be released within the next 6 to 12 months. Let's go get those individuals out on home confinement, barring there is no specific reason against doing so. Second of all, we need to make sure that those individuals who are currently on parole and or probation, over the age of individuals who are currently on parole and probation, don't necessarily have to report. Let's make their mandatory reporting. Let's move that to some online platform so that they aren't going to be risking themselves. The third thing, we need to make sure that individuals who are over the age of 65 years old, let's give them priority. Let's make sure that they get paroled, and especially those individuals who have underlying healthcare conditions. And last but not least, this is something that we can do that doesn't take an act of Congress. It doesn't take executive order to do so. It doesn't even take the DOC commissioner to issue a memorandum for. We need to make sure that there are hand sanitizing and personal hygiene products available to people who are incarcerated free of charge. I personally think that it is absolutely asinine to have individuals who are incarcerated, such as in the case in New York, where you have people who are incarcerated that are producing hand sanitizing equipment for the general public, but they are unable to use it themselves because it's considered contraband.
Yeah, I mean, it's really kind of incredible to think about that. Let me just ask you about the reality of the conditions inside prisons. Is it even possible to follow something like a social distancing 6-foot rule when you are incarcerated?
I mean, when you are incarcerated, institutions are not designed for social distancing. I think by virtue of having been removed from society in and of itself, inherent in incarceration, you are socially distanced from your loved ones, from society at large. But when you are incarcerated, I can tell you that sometimes you are in a 4 by 6 cell, probably a little larger than that, and you are in there with another individual. We had a conversation with an individual just this morning who reported that he is in an institution in Connecticut that has the highest rates of COVID-19 infections. But here's the caveat: he is not only in this institution, but he's in the cubicle. He is in a cubicle with 100 other individuals. They had individuals who actually tested positive, and because they didn't necessarily have a quarantine unit, the quarantine unit was filled to capacity. The individual who tested positive could not even be segregated. So this is an issue. People in prison, they feel as though that they have been sentenced to death when they only have a few days, a few months, and quite frankly, maybe 1 or 2 years to go.
I mean, what you're describing, Lewis, is exactly what the public health officials at the very highest levels in this country have been warning against, urging people not to get in close proximity to each other. There's one more aspect of this I want to talk about. You could frankly spend a whole segment on this, but in our remaining few minutes left, what about juvenile detention facilities? Do we know anything about how the virus is impacting youth who are behind bars?
Well, I can tell you this: juvenile detention facilities are no different than an adult detention facility. You are going to have the same security measures there so that contraband is not introduced into the facility, so that we can the dedicated men and women in uniform can make sure that they are protected, and also the individuals who are incarcerated or detained are protected as well. Transmission is happening. The proxy for transmission is through officers, people who have access to the general public. Now, it's my understanding that the Department of Corrections nationwide has suspended social visits to some degree, so that they can actually curtail the risk of people being infected. But truth be told, it's the people who are in uniform, the people who are returning back to their family members, the people who are showing up every day, making sure that they protect society overall. These individuals are bringing that stuff inside. And so we need to make sure that people on both sides of the fence are protected. Those who are in a prison uniform and also those individuals who are in a professional uniform as well.
So many important aspects to this issue. Louis Reed. Louis, thank you very much for joining us.
Thank you so much for having me on. Thank you.